Why do you look old? Like, what is it that as you get older, what makes other people look at you and say, that person is old? Today we're going to be talking all about SuneKOS. What is it? What can it do for you? And why would you bother? You have no doubt heard about these biostimulators or injectable moisturisers, as they are known as. I have spoken about polynucleotides a couple of times on this channel before, and also about non-hyaluronic acid biostimulators such as Sculptra, Lanluma, Elancei, Gowry, and so on. I haven't yet made a video just specifically about hyaluronic acid biostimulators, and that's really because there are just so many of them. There's a real plethora out there, and it can be difficult to differentiate between them. The one that I'm going to be talking about today is called SuneKOS. If you're in the States, too bad, because you haven't got it, which is a shame because it's very good. I'd like to first of all break down hyaluronic acid biostimulators into two camps. So in one camp you will have the cross-linked biostimulators, so that might be something like Belotera Revive or Restylane Vital, Juvéderm Volite. Going back a step, if you recall, hyaluronic acid dermal fillers are basically chains of hyaluronic acid which have been chemically cross-linked to form a sort of lattice work. Some of the products that we would traditionally call more of an injectable moisturizer, they are fillers in a way because they're cross-linked. And you would use them in a different way to how you would use the non-cross-linked version. So, for example, when you're using Belotera Revive, you do multiple small injections, tiny little blebs, not too superficially in the skin. And the whole purpose of this is to provide a more holistic whole face approach where you are holding water in the skin. You're also causing collagen and elastin formation. The downside of using these is they are literally just hyaluronic acid. Some of them do have extra bits chucked in there. So, for example, the Belotera Revive will have the addition of glycerol, and I do really like it as a product, but today I'm focusing on SuneKOS, which is the uncross-linked type. So you may ask, what is the purpose of injecting an uncross-linked hyaluronic acid? Because as we know, if you just inject uncross-linked hyaluronic acid, it's all gone within a matter of a few days. Well, the purpose of it is biostimulation. So how does it work? The vast majority of these uncross-linked hyaluronic acids, they will contain other stuff in them. So, for example, in a more traditional mesotherapy product, sometimes the practitioner will make up the concoction themselves and they'll add, I don't know, say uncross-linked hyaluronic acid with silica or with vitamin C, and they will play with the formulation themselves according to what the patient might want. This type of treatment is very popular in some of the European countries. There's a brand called Mesoaesthetic who do a ton of different products like this, and I actually think that they work fairly well depending on what it is that you're doing with it and what you're doing it for. The SuneKOS is kind of similar to this in that it contains hyaluronic acid, but with 6 different amino acids in it, which are in a very specific ratio, and this is their intellectual property. So I don't know exactly what the ratio is between all the different amino acids, but what I can tell you is that the manufacturers of this product have designed it so that it will stimulate as much growth of collagen and elastin as possible. Their proprietary formula, they call it HY6AA, which is probably not as catchy as in their heads when they were coming up with that name. The amino acids contained in SuneKOS are the same regardless of which SuneKOS product it is that you're using. So it has glycine, proline, lysine, alanine, valine, and leucine. And these amino acids are crucial in the formation of collagen. Why should you care about these different amino acids? Okay, let me tell you. Why do you look old? Like, what is it that as you get older, what makes other people look at you and say, that person is old? So there's this theory that as you age, you go one of two ways. So you either get really gaunt, skinny, and you can see that there's a lot of concavity in the face, or you become a little bit bottom heavy and more bloated looking. What's interesting about SuneKOS is it can actually treat both of those two things, but I'm going to come back to that. So at the moment, the dermo-epidermal junction is a real hot topic. And as the name would suggest, it's the junction between the dermis and the epidermis. Why is it important? Well, it kind of stops your skin from slipping down your face as you get older. So if your dermo-epidermal junction is strong, it means that the skin is going to become more firm, and you won't have the same kind of laxity as you otherwise might have had. There are skincare products that work on the dermo-epidermal junction. So one of my favourites is Revision. They've got, it's actually in the name, it's called DEJ Day Cream. DEJ Face Day Cream. It's got some weird long name. DEJ Face Cream Day. I don't know. And there's a night version as well, and also a booster. So one of the things that people get excited about is the type of collagen in the dermo-epidermal junction. And 4 and 7, although 1 and 3 are important as well. And they talk about how SuneKOS can help you make more type 4 and 7 collagen. Now, it's not the only treatment to do that. There are definitely others out there. So basically, if you can improve the dermo-epidermal junction, you're going to look better. One of the really interesting things about SuneKOS is this thing called the Interstitial Fluid Technique. Now, it's pretty old. I'm not even sure if they still teach this, because I did my training a long time ago on SuneKOS. And it sounds a little bit like hocus pocus. I totally get that, I know. So the idea is you're using lymphatic drainage in a specific way to encourage fibroblast growth in the direction that you want them to grow in. So for someone who is very slim and, you know, maybe they need a bit more fullness in the cheek, you are injecting the SuneKOS and then massaging the lymph forwards to create more fullness. If you're treating a patient who's got too much heaviness in the face, you're injecting it and then massaging backwards towards the lymph nodes. These are some quite interesting photos, but it just gives you an idea of the difference in the techniques. So this is a comparison between the right side of the face, which is the traditional micro-bolus technique, and the left side is the interstitial fluid technique. So to me, it looks like there's more of an improvement on the left side. Admittedly small, yes, but if you're going to do something, why not do it properly? For a slimmer patient, when you are doing the opposite technique, it's called the reverse interstitial fluid technique. And the idea is that you are not taking away the fluid towards the lymph vessels, you're leaving it in situ because they need more fullness. So in case you're curious, the normal way of doing SuneKOS is you will typically have 3 or 4 treatment sessions. I always recommend 4. Just because you're going to get a better result. The first treatment session, you will normally do SuneKOS Performa alongside SuneKOS 1200. And then 2 weeks later, you will do another Performa, and then 2 weeks later, another one, then 2 weeks later, another one. You don't repeat the 1200 again, although I have been known to do so in certain particularly tricky cases. Just an update since filming this video, the protocol has changed for SuneKOS, and now I'm doing 2 1200 sessions plus a Performa 2 weeks apart at the beginning of the course, and then another 2 further Performa sessions, and these are all being performed with a needle and not with the cannula. What's the difference between the two? Why do you need the 1200? Okay, so the SuneKOS Performa is like their older product, SuneKOS 200. So as the name would suggest, SuneKOS 200 contains 200 kilodalton size of hyaluronic acid molecules. 1200 contains 1200 kilodalton size of hyaluronic acid molecules. So basically, one's small and one's big. The 200 and the Performa are not the same. So the Performa's pre-mixed, whereas the 200 would come as two separate vials. The manufacturers felt that there was too much variation when people were mixing it themselves, so they just put them together. I'm sure there were probably multiple reasons why they decided to do that, but that's one of them. There is a slight difference in the amount of hyaluronic acid in both. There being slightly more, as in milligrams per mil in the Performa, but not by much. It's very marginal. The purpose of using the 1200 first is as an antioxidant. So if you remember a few videos ago, we talked about how high molecular weight hyaluronic acid tended to be anti-inflammatory and was generally considered to be a good thing, whereas low molecular weight hyaluronic acid was considered to be pro-inflammatory and helped tumour cells navigate their way around and generally considered to be a bad thing. There was a study on wound healing that showed that the native hyaluronic acid at 1000 to 1400 kilodaltons was not actually the best to stimulate wound healing and cell proliferation. Instead, a weight of 100 to 300 kilodaltons promoted the most wound closure and cell proliferation. So the 1200 kind of sets the scene for the Performa to come along and do its thing. The purpose of the low molecular weight hyaluronic acid is to help the amino acids get access into the cell. Okay, so what does it do for you? Right, so first of all, it's going to decrease the activity of the hyaluronidase, which is the enzyme that breaks up hyaluronic acid, by about 40%. That's because of the amino acids repelling the hyaluronidase. So it also decreases redness by 50%, just because you're making the skin thicker, so you can't see the blood vessels as much. Decreases pigmentation by 50%. That's because it's kind of spreading out the skin a little bit more, so you're stretching it, so the pigmentation is spread over a wider area. And more interestingly, it reduces the snapback test by half. So one of the tests that we do in the clinic when assessing whether or not someone's suitable to have under-eye hyaluronic acid fillers would be, we literally just pinch the skin here and see how long it takes for it to snap back. If it's anything more than about 3 seconds, then they probably need to do a course of SuneKOS or something similar prior to doing any other treatments. Otherwise, you're just going to wind up with a big old bag of fluid underneath your eye, because the hyaluronic acid will absorb some of the water that's already in the body and make it look really puffy. There are two other types of SuneKOS that I have not yet discussed. One is SuneKOS Body. As the name would suggest, this treatment is for the body. It still contains the same HY6AA formulation. It's in a little bit of a bigger vial, so you get more, as you would expect. And we would use it for things like stretch marks, scars, skin laxity. So it's quite good for, the little bit of wrinkling that sometimes people get here, or if they have any stretch marks, it would work quite well for that. I think it's important to remember that the way that this product is pitched is not just as a biostimulator, but they're saying that it will help to improve the localized environment that particular cell finds itself in order to optimize its functioning. Which actually, if you think about it, is the same as polynucleotides, because they are giving the cell more of what it needs to be able to function correctly, which, by the way, is why I suggest that patients alternate between doing a hyaluronic acid based treatment and a polynucleotide based treatment for the best results. Just touching on Cell really briefly. So Cell, again, contains the same HY6AA as the other products, but it also contains bicarbonate, so the pH is played with. The reason for this is cellulite is acidic, so there are too many hydrogen ions in that area. The blood flow is poor when you have cellulite. So there are a lot of treatments out there that try to help improve cellulite by increasing the blood flow. So one of them would be the traditional carboxytherapy, where you infuse carbon dioxide gas into the area and it encourages blood flow due to the Bohr effect. Carbon dioxide is detected by the body and it increases blood flow because it believes it's an area which is poorly oxygenated. It's a funny treatment, carboxytherapy. It's very retro. I think it's brilliant. It does work, but you're trying to replicate something like that when you use SuneKOS Cell. So by injecting the SuneKOS Cell, you're increasing the pH because of the bicarbonate, which then allows the SuneKOS, the proper part of it, to go to work. If you don't do that, then the amino acids will not be taken up into the cell in the proper fashion, and it won't work as well. So although SuneKOS Cell works on cellulite, the highest grade of cellulite it's not so effective at because there's too much sclerotic tissue there. But that's not to say that I wouldn't treat someone like that. I would do, but because it would have an improvement on the surrounding area, but then maybe they would need to do something like cellulase or something to just get rid of the final little bits. So a lot of people ask, right, why would I do SuneKOS rather than something like Profhilo or a polynucleotide or more traditional mesotherapy? Well, I mean, we do use all of those treatment types as well. I can tell you that I find SuneKOS to be clinically very effective for dark circles. It's one of my favourite treatments to perform around the eye because it's pretty much no risk. The biggest risk is you get a bruise afterwards, but that's not normally something that happens anyway. As I've already mentioned, in some patients, if they do have the need to have under eye filler or under eye threads, I would normally perform a course of SuneKOS first anyway, but I might switch that in with the polynucleotides for reasons that I've already alluded to, because you will get an even better result. There is a law of diminishing returns when it comes to this kind of treatment, so I wouldn't recommend just doing the same thing over and over and over again. What I like to do is switch it up. So it might be that you will do a course of SuneKOS, but then maybe you would switch over to doing something like Profhilo or a Bellaterra Revive, because they will have their own positive impact on the skin also. What with them being cross-linked, it's slightly different. It's a completely different thing. The last thing I want to show you, it actually doesn't even contain SuneKOS at all, but check this out. The reason that I'm showing you this is, well, it will become obvious actually when you see the graph. So this compares 5 different products. Viscoderm SkinCo, which is a product that I have not used, but Ipsa, who manufacture this, they're also the manufacturers of Profhilo. Newest is from Mastelli in Italy, and that contains polynucleotides and hyaluronic acid together. The next is actually not intended for skin use. It's intra-articular purpose, so osteoarthritis. It's called Hyalgan. The next is Juvederm Skin Vive if you're in the US, or Volite if you are not. And the final one is Restylane Vital. Of course, the Volite and the Vital are cross-linked. This graph here looks at a gene which is responsible for producing elastin. Now, this is an in vitro study, so you can extrapolate from that what you will. I just thought it was interesting. So if you look at the first column, the Viscoderm SkinCo has got much greater gene expression than the Restylane Vital, which shows the lowest. Whereas if we look at the hyaluronic acid synthase gene, it's actually the other way around, kind of, except this time the Juvederm Volite has got the lowest. Just because a product has got more of something in it doesn't necessarily mean it's going to be better. Sometimes it's better to have less of something if it's going to give you the right result. I guess you would call that the Goldilocks zone, right? And also it depends on what you're measuring. So if you're measuring this particular gene for elastin, then yeah, the product that contains the amino acid comes out better. But if you're measuring it for the hyaluronic acid, then the other one comes out better. I think some of what we see with these products is definitely down to the special source, if you like. Like, you don't know exactly what's in the buffer, what is the pH of the product that you're injecting. Did you have to mix it up yourself? Is there some kind of margin for error there? But what I can tell you is clinically what things look like, because I've been doing this for so long, seeing a lot of people every week and doing a lot of this type of treatment. And the SuneKOS, I really think it's a really good treatment. As I mentioned before, there's very little risk with it. And if you're somebody who you don't want to have a traditional filler, you don't want to have surgery, you just want to have a bit more freshness, you want some skin quality improvement, then this is probably a really good option for you. Again, if you're looking to treat the body, maybe you've got a bit of cellulite, maybe you've got some stretch marks to treat or some skin laxity, and it's not that bad that you would need to do some kind of body lifting procedure, an arm lift or something, but you want to see an improvement, this is a really compelling choice. Well, I hope that was helpful. If you have any questions about SuneKOS, let me know in the comments below. Maybe I'll be able to answer them. And if you like that and you want more quality content, then please subscribe.